Hi, good morning, everyone. It's so nice to meet you virtually, and I can't looking forward to meeting you all in person, especially the London students soon. Um, so welcome to your induction day. I hope you enjoy the day and that it's an amazing start to an amazing future within echocardiography. So um, you you've won the lottery joining this job. If I can get the next slide, please. I'm going to talk through an overview of the program. Some of this you may be aware of as you've started the program, but you should be employed as an ETP trainee at a band 6. Um, uh, for 18 months, there's funding given to hospitals and trusts to employ you at a band 6 level for the duration of your course. You are entitled to study leave. So most students have 1 day study leave per week. That study leave is a really important day. It allows you to, plan and prepare and revise for your theory exam, do your university assignments, do your one file and work-based assessments as well. So please try and utilize that study day efficiently because it's the full-on program and there's lots of work to do outside of the program. It's not just going to work for the 18 months. You actually have to work hard outside of that throughout the whole program to successfully complete in time. So please utilize that study properly. You're entitled to annual leave, which I'm sure you're happy to hear. My only caveat with that is just be careful when you're taking annual leave. Make sure that you're looking at your university exam dates, your deadlines that you have for courseworks or assignments, logbook collection deadlines, um, theory exam dates, practical exam dates. So when you are planning your annual leave, please discuss that with your training officer carefully so that you're not taking your annual leave at the wrong time of year, when you've got a massive deadline looming. So just be wary of that. You also have access to funding, which you will be able to access through your trust. The funding is typically used for, either preparation courses or um, accommodation for when you go to university, train fares, all those kind of things, and speak with your training officer about how to access that funding as well. Next slide, please. So you've seen this slide a few minutes ago with Jane. So it has the ETP program has three main pillars, I like to call them, and each pillar is individually important, but you need to have them combined to get your certificate of completion and get. So your first one would be the postgraduate certificate in echocardiography. So that's all the stuff that you do at uni, all the assignments, the exams. When you successfully complete that whole process at university, you'll get your postgraduate certificate in echocardiography. You also have your one file assessment, which is your work-based competency assessments. So soon you should be getting log-ons, details to access your one file. When you do access your one file, I would say at least allocate two training officers to your portfolio so that they have access to your portfolio and they can mark and assess your work that you upload onto there. You also have to complete your BSc accreditation, and I'll break that down for you further along the slides, but you have to complete your theory exam, your logbook, and your practical exam in order to gain successfully pass the BSc accreditation. And we'll talk through the timeline of that as well in another slide. But all of those things combined would give you your certificate of completion for the program. Okay, next slide, please. So the whole point of the ETP program is to combine the academic learning the theoretical knowledge that you'll gain both from the preparing for your BSc theory exam, but also the academic components. You've got university assessments and exams, and you also have two modules on the one file assessment, which go towards the academic components. So when you get our login, you'll be able to see them in a bit more detail, each area of competency and each type of competency for work-based learning. So you have modules on there, you've got one file assessments, you have OCs, case-based discussions, and DOPs to complete in order to successfully show the evidence of the work that you're undertaking within the workplace. So these will both be experiential learning and clinical experience combined. Next slide, please. So with your academic learning, we just break it down a little bit more. So you'll be doing your postgraduate certificate in echocardiography. Some of you may have already been to university for the first couple of weeks. It is broken down by region. So you have Manchester Metropolitan Uni, University of Newcastle, and University of West England. And you can see on the map where you tend to go will depend on where you are regionally. Next slide, please. So the University of Newcastle, you've got block 1 in November 2025. I hope you all have received all your dates for all of these. And block 2 in February 2026. UE is slightly different. You've the two blocks. Block 1 is in October. That's 2 weeks in October. And then they have hybrid learning lectures, which happen 1 day a week until March 2026. And you'll have block 3 and 4 in January and April 2026. Again, not just these dates, you may have to look out and plan and in advance for any exam dates that you have to go in for as well. So keep an eye on that as well. Next slide, please. So the work-based learning component will be your one file assessments. Like I said before, there are two modules on there. You'll have training activities and assessments on there. Part of the training activities, you'll need to show and provide evidence of work-based competencies that you've met. So say, for example, it was to assess aortic stenosis, you would need to show evidence that you've completed a study for aortic stenosis, upload evidence, complete a little bit of theory information surrounding that you understand the measurements that are involved when you're assessing aortic stenosis, etc. And you kind of upload that to one file, and then your training officer will mark that and they'll have a look. The evidence you submit and the supporting documentation you submit goes through Turnitin, so it's checked for originality, and your training officer will have a chance to that and mark it off as it's pass or fail. It's not like you get a grade, but you'll have there's lots of different competencies that you have to acquire as a part of the one file. The way that I get my students to look at this is trying to do at least 10% every month as part of their training plan, so that they can complete the one file in time. It actually takes a lot longer than what you think it will take, so allow yourself lots of time to kind of do it and just work on it slow and steady. Even if you do 1 hour every time you've got a study day, 1 hour of putting together all your evidence for the one file competencies, it allows your training officers sufficient time to mark it. It's not last minute, and it also allows you to kind of steadily work on and build up the one file work-based portfolio that you need to develop. Next slide, please. Okay, so these are some really good supporting documents to help you with your one file competencies, with your case-based discussions, your training activities, and mark sheets for your training officers to use. I think I'm right in saying they're available on the National Schools website in the curriculum library. Is that correct, Sally or Jane?
I'm not 100% sure, actually. I'd have to check.
Okay, so I think these have been developed by one of the practice educators, but they're really good for your training officers, and it's good for you to understand how you're being marked. So it is worth having a look at speaking with your training officers, because these are not compulsory, but every training officer may have a different idea of what they expect as evidence. So I would set the ground rules at the beginning and say, okay, for these type of competencies, what kind of evidence would you like? Rather than them going backwards. Some training officers prefer referenced items, some training officers prefer you to do things in a certain way, upload pictures. Evidence can come in all forms, and the supporting documents will be in relation to what you and your training officer agree. So I would say start off early by having that discussion with your training officers, what type of evidence that they want you to provide as supporting evidence when you're uploading your competencies. Okay, next file. So the BSc accreditation, you'll be, hopefully by the end of the program, you'll be obtaining your level 2 BSc accreditation. You will have an opportunity to take your written theory exam. Your first opportunity to take that is in March next year. In order to register for that, you have to become a BSc member. So if you haven't already done that, do start thinking about that. And then you should register for the exam as soon as the dates open. Please be aware and try and keep an eye out for these opening dates for the registration for the BSc, because the BSc accreditation is incredibly popular, and normally within a day or two of the opening date of registration, the spaces are full. So please keep an eye out for the actual dates when you need to register, and use that as your guideline, rather than, I know they have like 3-4 week windows of registration opens from this time to this time, but actually you need to really register within the first day or two. And there's a link on where you can go to join the BSc and then register for the exam appropriately. The theory exam is made up of multiple choice questions and an image reporting section. So you have two different types of exams. You've got the multiple choice section and then the video case reporting section. The multiple choice section consists of 25 questions, and it should be answered within 60 minutes. And the video imaging one consists of 50 questions that must be answered within 90 minutes. And all this information is available from the website. Next slide, please. So the practical exam, you should be ready to have your first attempt at the practical in March 2027. So that's 18 months from now, or just around 18 months from now. You have to have completed your logbook, which is your 250 cases of different studies, by December or January of prior to that. And you also have to, on the day, be ready to present 5 video cases. So you'll be asked to show maybe 2 out of those 5 cases, but we only know on the we only know which cases they want to view on the actual day. So you have to go prepared, ready with 5 video cases. The practical exams are held 5 times a year in different locations up and down the country. And again, be quick with registering for the practical exams. Spaces go very quickly. You will be required to attend a practical exam within 26 months of starting the accreditation process. Okay. And then you have a grace period as well. Again, if there are extenuating circumstances and so on, you can contact the BSc to see if there is any extensions. That it's your responsibility, candidates' responsibility, to make sure they have all the correct details in the registration forms, and they've got all their logbooks cases ready and submitted in time. So speak with your training officers, try and set up a plan with your logbook, so that you are collecting your logbook cases early on, you know, as soon as you're able to start, you feel confident enough to start reporting and collecting logbook cases, start collecting them slowly. The issues people tend to run into is not having enough of a case mix, because you can only have, you know, it's 30 normal, that there are certain set criteria that you're allowed, and sections. So sometimes that you may be doing lots of scans, but if you're only doing normal scans, you're not going to get your case mix that you need for the BSc accreditation. So it's not just, okay, I have to provide evidence of 250 cases that I've done and you've just scanned 250 people. No, you're probably going to be scanning a lot more people just to get those 250 cases for the to get the right case mix in order to submit it for the registration. My top tip for that would be to try and have a very good reporting style from early on. Start off how you mean to go on, so you're not thinking about, oh, I need to look at my format later on, and oh, I haven't written this well enough in order to include it as my logbook. Start with good reporting format, guided by your training officers in your workplace. Self-check your reports as you're going along. So if you're saying that the patient has a dilated left atrium, check, do your measurements match up to that? And do that, you know, routinely with every single report that you're doing, so it becomes second nature and becomes habit for you. And then when it comes to collecting and putting together your logbook, it won't be so much of a task. So try and do that from early on. Next slide, please. So this is a kind of like time flow. So the written exam will be in March 2026. I can't believe I'm saying the year 2026. If you don't pass on the March attempt, you can take another, there will be another attempt to take another opportunity to take the theory exam in October of or autumn of the next year, of the same year, sorry, so autumn 2026. Generally, most people pass within either the first attempt or the second attempt, and you know, so that they still are on track to gain their accreditation within the 18 months. After you've kind of worked on passed your theory exam, you need to really start thinking about your logbook collections and so on. And like I said previously, you're looking to be submitting that of December 2026, January 2027. So, you know, if you're planning any holidays or anything like that, try and avoid these dates when you've got kind of especially your logbooks due in, because there's a lot of work last minute to get those logbooks up to scratch, and make sure and triple check that you've anonymized everything, and make sure you've got everything in the right section, and you've reviewed all your images that you've gone through, but also not to leave everything to the last minute with your work-based supervisors and your training officers, because they're going to look through these cases, and they don't want to be spending Christmas looking through all of your 250 logbook cases because you left it to last minute. So please start early on, start collecting your cases, start uploading them according to the agreement that you have with your training officers, and make sure that, you know, you double check and triple check things, so that your training officer, when they're looking through them, is just going through it with a fine-tooth comb. They're just doing the final checks, but you've already checked it plenty of times. After submitting the logbooks in, say, for example, December 26, you will be looking to have your practical assessment mainly in March 27. So between submitting your logbooks and doing your practical assessment, you can carry on with making sure your one file is completed and your video cases are all prepared and ready. Again, finding the perfect video case takes time. I get my students within London to try and do one video case a month, you know, at least try and prepare it from the September of, say, for example, September 26th. So by the time they get to February, they should have all 5 video cases, and in preparation for the March exam. And they also have an opportunity to present it, you know, to the rest of the cohort, get some feedback on it, you know, used to presenting it and used to owning that kind of their their video case and getting proud of it, really, and talking through it. And yeah, so once you've passed your practical assessment, that's it. You've just got to submit your one file documents and work-based competencies, and you can give yourselves a big round of applause. That will be the end of the program, hopefully, for many of you. So yeah, that's an overview of the BSc assessment. It looks easier than it's done. The BSc have a logbook portal, online portal here. As you can see, it's separated into different sections. So you have left ventricular abnormality, which is, anything with an LVEF of less than 50%. Regional walls, again, it should be the ejection fraction should be less than 50%. You have a valve disease section, which is the valve disease section. You should have mainly moderate and severe cases within there. You have replacement valves, repaired valves, right ventricular abnormality, abnormality of the aorta, hypertrophic cardiomyopathy, pericardial disease, pericardial effusion. You have confirmed endocarditis or mass or thrombus, an LVH section. So you have a variety of different sections within there that you have to populate. And some, for example, the normal section, you cannot have more than 30 normal cases. Valve disease section, I think you need 50 valve disease, so 50 moderate to severe valve disease. So that would be severe AS, moderate MR, severe TR. You have to have at least 50 of those kind of cases. So you need to make sure that you are rotating and you've got enough access to pathology. And if you have any problems, and if you see that being a problem going further down the line, please speak with your training officers, try and arrange early on, to get the exposure that you need in those particular areas. Next slide, please. Just to go back onto the logbook portal, once you upload to the online portal, they have an anonymization tool on there as well, which is really good. So you can actually anonymize the reports on that tool as well. Okay, so the completion criteria, again, I've just get your e-portfolio done of your work-based assessments, which is your one file assessments, successfully finish and complete your PG cert, and successful level 2 BSc accreditation. Okay, next slide, please. Just a timeline for completion. First exam in March 26 for the theory exam, the written exam. You have another opportunity to resit that in October of 26. In March 27, you should finish, I think March 26. By March 27, you should have your PG cert, but I think you finished before. You'd be finished in July of 26. And you should also have your opportunity to have your BSc practical, your first attempt at your practical exam. Some people do opt to take the practical exam a little bit earlier if they feel that they're ready, but March 27 is generally when most of the cohort do take the exam. And by the beginning of April, you'll have your one file submission, which is you'll submit everything, all your one file competencies you've done, your work-based competence. And if you're not successful at the first attempt of your practical exam in March, you do have an opportunity of a resit, but that would have to be arranged and discussed with the national school to apply for an extension. And you need to do that in advance as early as possible. Okay, next slide, please. So top tips for the first 6 months. Please go and join the BSc. You need to get that to access your logbook portal. So please join the British Society of Echocardiography as soon as you get an opportunity. When you are requesting access to the logbook portal, you'll need to assign a training officer or mentor, workplace mentor. So discuss with your training officer who that's going to be, and you may want to put 1 or 2 training officers or mentors to have oversight of that, just in case one of the training officers or mentors are off ill, or on long-term sick, or these things happen. So you need to make sure that you've got a couple of people who have access to the as a mentor to your logbook. You should have a training plan put in place. Work with your training officers, ask to see your training plans so that you can work towards those training plans, and make sure that you're keep on target. This is your workload, this is your training. You need to take ownership of it. And one of the ways of taking ownership of it is to have a good training plan in place, that you've, in collaboration with your training officers, and stick to that training plan so that you've got timelines, you've got accountability as well. You need to get OneFile access, and that that will be given to you soon if you don't already have it, and that will give you access to the online. You start doing those OneFile competencies. You'll be surprised, some of those competencies you'll be able to make a start on even now, just a couple of weeks in. So please do try and have a look at the competencies that are on there, read through them all, have a quick look and think, okay, I can do that, that one's all right, and start on those easy ones first of all, so that you can just get out of the way and draw a line under it. You need to know when your university blocks are, your assignments, your exams. Make sure you plan and prepare for that. So you book the accommodation if need be, train tickets, and so on. Start thinking about what type of BSc prep courses you want to attend. There's an online preparation course run by the BSc that gives you access to that you can basically learn at your own, you can progress along in your own way, or you can actually there are other prep courses up and down the country. So start thinking about if you want to attend a theory exam prep course, and which type of course you want to attend. And obviously by the end of these first 6 months you'll be doing your BSc written exam, so try and studying for that is the big part of what you'll be doing within the next 6 months, and a lot of your time during your study days should be spent on trying to prepare for that exam. And more importantly, you'll be gaining hands-on clinical experience. You'll get scanning, you'll be learning your scanning skills, deciding if you're a left or right-handed scanner, lefty here. Making sure that you're keeping to time with your scans. You're learning the pathology. It's going to be a huge steep learning curve these 18 months. You will learn something that generally takes 2-3 years, you'll be covering within the next 18 months. So it's a lot of hard work, but by the time you get to the end, it's so worth it, because you will be, you'll have the starting point for an amazing career within echocardiography. So try and enjoy this learning experience, even though it can be a bit stressful. Try and enjoy it as much as you can. Next slide, please. So these are just some examples of your training plan, the national school, from the national school. But if you can speak with your training officers and just try and see your own individual training plan. With the London students, I am creating I will have some training plans, like a Gantt chart, to allow you to see, when you need to get things organized and done by, and give you key dates, completion dates, so that you've got a clear oversight what you've got to do by when. But speak closely with your training officers and see, and your practice educators in your region, if you've got them, and see what are the training plan that you are working towards, so that at least you've got a goal that you can set. So as you can see, by the end of it, you want to get to 100% of your OneFile done. And with this over here, you can see the OneFile in 10% increments, month by month, until you reach 100%. Your video cases, month by month, just doing one video case a month. Your logbook cases, collecting all your cases, 25 or 30, just going up however many until you reach your 250 cases for the thing. And then it's got here the key exam dates for your practicals and your theory. And then here you have more detailed training plan, which will be actual things that actual pathologies that you need to cover in detail, and assignments from universities which you may be given, audits that you may need to undertake. So it has more detail in that training plan there. So speak with your training officer, speak with your practice educator about, having a look at your training plan, or seeing whether you can come together and develop a personalized training plan according to where you are in your training and what you need. Okay, next slide, please. Okay, so as a practice educator, so I've been a practice educator coming up for about 2 years. What we offer would be sort of an induction. We can help with theory and education for the whole throughout the 18 months. Holding, some of us are hold training sessions or educator sessions. We can offer support with like simulator sessions, so you can get some of that hands-on experience if you're finding it difficult, especially at the beginning, to get that hands-on time where you want to develop your skills. We can help and assist with simulator sessions. We can help with exam revision, provide mock questions, quizzes, so on. We've also been involved with BSc exam mocks, so practical exam mocks, to help you kind of get a feel and understanding of what it will be like on the day of the practical exam. The logbook and video case support, so help you with book guidance and what kind of things you need to put in each sections of your logbook, how to self-check your logbooks, what kind of reports that you should be writing, video case support. So I do sessions with my students on what kind, top tips for collecting their video cases. We also review video cases on a monthly basis. Like I said, from September onwards, that I have soft targets for my students to produce and create video cases for each month leading up to their practical exam. Help with one file support and guidance, how to do case-based discussions, what kind of things you need to do in order to get your case-based discussions, provide templates for the assessments on one file, help with monitoring and keeping you to task with your training and your progression. So like I said, if I'm going to be, as for my students, I keep an eye on what progression they're making. Are they meeting their targets and so on? Also help students with who are struggling, and anyone who's got individual training needs within their own trust or hospital, and they're having issues, say for example in their department. We kind of can help reach out and come and see them in the trust, and speak to them and see what support we can offer and help. And also it's really important that we collaborate nationally and within the region, so that we can all work together to kind of create good quality, high quality, but equitable training across the region and across the UK. So having practice educators to help and support that training and learning really does help make a difference. So it's lovely meeting you all, and I look forward to working with you all closer again, and good luck with your careers. And to all the London students, nice to meet you. I'll be reaching out shortly. Thank you.